Welcome to Pajon Imaging Hub. In today's Radiographers and Health Professionals series, we look at how to make diagnosis of pneumothorax in chest X-ray. Please don't forget to like, share, and subscribe to this channel so you'll be notified when new video is released. Welcome back. What is pneumothorax? Pneumothorax is the trapping of air in the pleural space. It could be simple or tension. Now, tension in simple pneumothorax, there is no mediastinal structure shift. But in tension pneumothorax, there is mediastinal structure shift. There could be shifting of the trachea, the heart itself to the opposite side of the pneumothorax. Then, what are the clinical signs of pneumothorax? First, one of them is unequal breath sound. You see there is a reduced or absent breath sound on the affected side compared to the other side. This suggests that there is possibility of pneumothorax. The second one is hyperresonance. There is increased resonance when percussing the chest wall on the affected side. This also indicates presence of air. So it's a suggestion of pneumothorax. It's a clinical sign. Then there is a decreased chest wall movement or absent movement of the chest wall on the affected side. Then sharp stabbing chest pain, maybe the sign also, especially with inspiration, and shortness of breath can be seen. Then crepitance. This has to do with hearing a cracking sensation under the skin. It's also a sign of a clinical sign of pneumothorax. So when doctors see these signs, they can infer that there is possibility of pneumothorax. So the patient is being sent to the radiology department for X-ray. So what are the radiographic signs we look at for in chest X-ray to make this diagnosis? Then we try to see whether there is a pleural line visualization, which try to separate the air. The pleural line is the border of the lung. It separates the air from the thoracic wall. Then look out for absence of lung markings in the area of the pneumothorax. Then the shift of mediastinal structures and even shift in diaphragm in case of a tension pneumothorax. So let's look at these X-rays and see how this appears. See, this is the pleural line. So this place is devoid of lung markings, is the pneumothorax. Yeah. Now the trachea is a little shift to this side, but there's a pneumothorax here also. You can see the pleural line also here. There is suggestion of lung collapse here that pulls this trachea to this side. We'll look at this second chest X-ray. You see the pleural line here. Then you see this place is occupied by air, is the pneumothorax. The aorta and the pulmonary vessel has been pulled to the other side. You can see them here. So this is a tension pneumothorax. You can appreciate the lung marking. So there is no pneumothorax in this side. But here there is no lung marking. Depending on the degree of the tension pneumothorax, the diaphragm can be pulled downward. But this is still appear normal. The diaphragm here still appear normal. But there are some cases the diaphragm will pull downward, and even the degree of shift of the mediastinal structure will be high. But this is not that. The diaphragm is still normal. So that is how to make this diagnosis of pneumothorax in chest X-ray. Thank you. Like, share, and subscribe to this channel. Bye for now.